Hey again, it's Katie.
And Dr. Stanley from the Smile Center.
And we're talking about some of your frequently asked dental questions. So Dr. Stanley, this is a big question that we get sometimes. Why or what can we do for people who have anxiety or fear of the dentist?
Well, first off, you need to find a gentle dentist.
Good first step.
That's a good first step. And then secondly, we have a number of things that we can do. From the sedation standpoint, we can do something as simple as nitrous oxide, which is also called laughing gas.
Okay.
That's been around for ages, and it's very effective. It takes the edge off the patient. It also reduces some of their discomfort. And the nice thing about it is it's very quick to go into effect. So we put the little nasal mask on the patient, and that within a couple of minutes, they will start to feel the effects of the nitrous oxide. And then when we are done with our procedure, we take that mask off, and the patient within just a couple of minutes goes back to just their normal life. So they can actually drive and leave the office and go back to work or go off and play golf or whatever they want to do for the day. So another thing we can do is we can do oral sedation where we use tablets. So we use essentially one of the most commonly used sleeping pills. And that is a great medication because in most cases it lasts only a couple of hours, which allows us to do our procedure very effectively. And the patient doesn't remember anything about being at the dentist. So it's a great way to go. So they're kind of asleep through the procedure, kind of a twilight sleep. They can still open and close and respond to us to help us do the things that we need to do, but they don't remember being there, which is a great way to go.
Sure.
And essentially when we do those procedures, that medication is very similar. It's the same kind of drugs that we use with IV sedation, which we can also do, but we don't have to start an IV. So it's kind of a nice way to go. You do have to have somebody bring you to the office and somebody to take you home and stay with you afterwards because you're going to be sedated for several hours after that procedure. Additionally, we can do the IV sedation. Again, same kinds of drugs, but we start it with an IV in their arm or their hand. And the advantage to that is it's very quick. We can get the drugs in there very quickly, so we can get them into a sedated state very quickly, and we can add additional sedation if we need to. But for most patients, the oral sedation with the tablets works wonderfully. We don't have to go through some of the other things we have to with the IV sedation, and the patients have a great experience. So very nice ways to go, and patients really appreciate the fact that they can go to a dental visit and not even remember being there for the day.
Yeah, that's great. Lots of options for our fearful patients. So.
Very exciting.
Good. Thank you.
You're welcome.